The history of whole body vibration is quite interesting. Very famous neurologist named Jean-Martin Charcot used whole body vibration to alleviate symptoms of Parkinsonism. He noticed that his patients coming from afar after a half-hour carriage ride, which was obviously very bumpy, had less tremor than they had previously, and he reasoned that the shaking of the carriage may be contributing to some neurological response by the brain to reduce their tremor. So he developed the first whole body vibration machine, and he, as you can see in the picture on the right, it was a hand cranked chair that moved these patients to reduce symptoms. Charcot is very famous for many diseases that we all learned in medical school and chiropractic college, and so he's a well-known neurologist. Charcot worked alongside another man called Tourette's. Now you'll recognize Tourette from his well-known syndrome called Tourette's syndrome. Well, Tourette noticed the improvement in the patients that Charcot was examining using his chair, so he devised a device that would shake the brain to reduce some of the psychological illnesses that his patients had. However, there was no effect. But recent studies on Parkinsonism has shown that scores improved by approximately 15%, and with subscores of tremor and rigidity most effective. So science is now showing that Parkinsonism symptoms can be reduced by using whole body vibration. There was a German scientist named Dr. Biermann who first started to investigate whole body vibration on the trunk, and he noticed that it increased trunk flexion. Another, that same Professor Nazaroff that I mentioned earlier, used the whole body vibration techniques to train Russian athletes, and they both found that there was an increase in muscle strength and power in athletes who used whole body vibration. Professor Nazaroff found that whole body vibration greatly increased range of motion, and he hypothesized that whole body vibration increases overall flexibility and improved blood flow.